What do endoscopic ultrasound, EUS, findings mean for stomach cancer? Imagine having a tiny, high-tech camera that can look deep into your stomach walls and nearby lymph nodes all at once. That's what endoscopic ultrasound does. It combines a small ultrasound device attached to an endoscope, which is inserted through your mouth into your stomach. This allows doctors to see detailed images of the different layers of your stomach and the surrounding tissues. When it comes to stomach cancer, EUS helps determine how far the tumor has invaded the stomach wall. It can tell whether the cancer is just on the surface or has penetrated deeper into the muscle layers or even the outer lining. This is called the tumor or T stage in cancer classification. Usually, EUS is quite accurate at this, especially for early-stage tumors that are limited to the innermost layers. It can distinguish between tumors that are confined to the mucosa or submucosa and those that have grown into deeper layers. This information is vital because early-stage cancers might be treated with less invasive procedures, like endoscopic removal, while more advanced ones may need surgery or additional therapies. EUS also looks at nearby lymph nodes, which are small immune system structures that can sometimes harbor cancer cells. It can identify suspicious lymph nodes by their size, shape, and appearance. Sometimes, EUS-guided fine needle aspiration is used to take a small sample from these nodes, helping confirm whether they are affected. While EUS is quite good at assessing the tumor depth, its accuracy in evaluating lymph node involvement is a bit lower, but still helpful for planning treatment. The findings from EUS are crucial for deciding how to treat stomach cancer. If the cancer is limited to the surface layers and no lymph nodes are involved, less invasive options like endoscopic procedures might be enough. If the tumor has invaded deeper layers or lymph nodes are affected, more extensive treatments like chemotherapy before surgery might be recommended. EUS can also sometimes detect other nearby structures that might be involved, such as parts of the liver, which helps in staging the disease more accurately. It's important to remember that EUS results are not perfect and depend on the experience of the doctor performing the procedure. Sometimes, additional tests like CT scans or MRI are used alongside EUS to get a complete picture. Also, after treatment, EUS might not be as reliable for restaging the cancer. In summary, EUS findings give doctors a detailed look at how deeply stomach cancer has invaded the stomach wall and whether nearby lymph nodes are involved. This information helps guide treatment choices and gives an idea of the prognosis. But always remember, these results should be combined with other tests and clinical information, and decisions should be made by healthcare professionals who can tailor treatment to each individual. If you or someone you know is facing stomach cancer, discussing these findings with a medical team is the best way to understand what they mean for your specific situation.